Hello everyone, welcome back to Doctor's Quiz. In today's video, you are going to face MCQ questions from Gynaecology, Obstetrics and Pediatrics subjects. As usual, the time limits for each question is 5 seconds and get ready to check how much you can score out of 25. Come on, let's get started. When the Mullerian eminence ruptures into the vesico-urethral part of the cloaca instead of the pelvic part of the urogenital sinus will develop vesico-vaginal fistula. Collection of blood in fallopian tube is known as hematosalpinx. Failure in the fusion or canalization of the urogenital sinus and the Mullerian ducts will lead to transverse vaginal septum. The additional ureteric opening is usually in the vestibule close to the urethra or in the vagina, known as ectopic ureter. When the Mullerian eminence opens in the dorsal segment of the endodermal cloaca will lead to the formation of rectovaginal fistula. Collection of blood in uterus is known as hematometra. The failure of disintegration of the central cells of the Mullerian eminence that projects into the urogenital sinus will develop abnormality in hymen. Collection of blood in vagina is known as hematocolpus. What abnormality will happen to the vagina when the distal parts of the Mullerian ducts fail to fuse? Longitudinal vaginal septum. An outer layer of multinucleated syncytium is called syncytiotropoblast. How many layers are in a decidua? 3 layers. The cytotropoblast cells invades the lumens of the maternal spiral arteries known as intravascular extravillous cytotropoblast. The fibrous connective tissues of the stroma become changed into epithelioid cells called decidual cells. The cytotropoblast lines the villus stems known as villus cytotropoblast. The endometrium of the pregnant uterus is known as decidua. The cytotropoblast cells that invade the decidua known as interstitial extravillous cytotropoblast. Before implantation, the tropoectodermis further differentiated into an inner mononuclear cellular layer called cytotropoblast. The child started observing his or her own hands very intently between 12 to 20 weeks. This is called as hand regard. At which age a child can feed himself well using a spoon? By 18 months. At which age the child can bear almost all his weight when made to stand? 6 months. At which age the child can sit steadily with support of pillows or the examiner's hand? 5 months. Mature grasp is evident in babies at the age of 1 year. Steady sitting without any support generally develops at which month in a baby? 8 months. A child can transfer objects from one hand to another by the age of 6 to 7 months. Between which month the child starts walking independently? 13 to 15 months. If you are interested to learn medical subjects through quizzes, then do subscribe to Doctor's Quiz. See you all soon in the next video. Until then, bye bye. Take care.